So good evening everyone. Today we will discuss a very important topic of general anatomy, that is the skin and its appendages. And this is one topic I think you have been reading a little bit about it previously also. So let us dive in. And as you know, we will be discussing all the topics as per the NMC curriculum. So that has certain competencies. Okay, so they are denoted by AN and then there will be a number, okay, in front of it. So you all need to pay attention to these competencies, as I emphasized in the previous class also, because your university exam papers will be set on these bases only. So if there is a competency for that topic, definitely it is to be asked in your theory exams as well as viva, although viva doesn't have any boundary also, sometimes the examiner can go beyond that, but theory paper is officially set within the competencies only. And if there is some topic which you have read but it is not in the competency, then it may or may not be asked in the theory exam, okay, although it can be asked in viva. So let us see what we will be discussing all the competencies initially for every topic like we are discussing today, so you will get a knack about it. So first and foremost, we need to understand the different types of skin and the dermatomes in the body. We will take up dermatomes separately when we will discuss the region wise. Then we need to understand the structure and function of the skin with its appendages. So that gives us an understanding that function is very important along with structure. So we need to know the layers of skin. Okay, that is extremely important from this topic. Then we will talk about the superficial fascia along with the fat distribution in the body. Okay, and then the modifications of deep fascia with its functions and the principles of skin incisions. So most of these things, like the competency number 4.3, 4.4, 4.5, even 4.1, all these will come repetitively in the subsequent topics region wise, so you don't need to bother about that. Be assured, I will cover all your competencies for every topic, don't worry on that. Okay, you can relax. So let us discuss first the introduction. So this skin basically we are referring to as the integumentary system, if you remember. Integumentary system. And please pay attention to the spellings, because in medical, there are different words which you will hear for the first time, and so you need to pay very much attention, because if you know the answer, if you write in the theory wrong spellings, your marks will be deducted. Okay, so be very sure on this. So the integumentary system, it consists of the skin and its appendages. So that would include the things, that is the skin, which consists of its two layers, which are the epidermis and dermis. We will take them up in detail. Okay, then the appendages. What are the appendages? As the topic is there, appendages includes the hair follicles and the hair itself. Then you have the sweat glands. Okay, the sweat glands. Then we have the sebaceous glands. I will try to show you in 3D everything wherever required. Okay, and then we will discuss something about the nails, and it's actually very interesting also. Then the mammary gland. A mammary gland we will discuss separately when we will discuss the extremity of the upper limb. Okay, so there we will cover that, but yes, to complete the list we are writing it. Okay, so this all is included in the integumentary system. Okay, so then if you have heard, there is another word, that is the hypodermis. Okay, hypodermis. What is this hypodermis? This consists of the adipose tissue. Okay, primarily the adipose tissue. Okay, which lies deep to the dermis. Okay, I will keep on writing the key points everywhere. You will get the PDF, don't worry. Okay, so this hypodermis is basically, we are talking about the subcutaneous fascia only. Okay, so this is the beginning and understanding about what we are going to deal with. Okay, so that is the different things in the integumentary system. And if you want to have a look in 3D, you can have an understanding. If I go on to the full body model, you can see here, if I bring up this integumentary system, okay, so this is the skin, okay, which we are able to appreciate. We have the male and female bodies separately. Okay, so this entire structure which we are going to discuss, this is skin, and there are a lot of appendages which includes the hair follicles. You can see them, although the head is shaved, but there will be hair here, okay, in this place. So you can find this skin is such an important thing, and you know now what all things are there. And similarly, if we go for the female model, let me show you. So here you can see the breast, the mammary gland. So that is the reason why we included the mammary gland in this list. Okay, so this is the female model. We will discuss region wise everywhere whenever it required. Okay, so let us go back. So the skin is the outer covering of the body, which is supported by all these appendages, and also the derivatives of the skin like the hair, nails, sebaceous glands, sweat glands, which we just listed. So I can fairly say this in a very simple statement: skin is the largest organ, okay, largest organ of the body. Okay, it constitutes about 15 to 20% of total body weight. 15 to 20% of total body weight. Okay, so what are the functions of skin? And you know, this is as per the competency, it is required to understand what are the functions. And a matter of understanding for all of you, that in your exams preferably use the blue pen and the black pen. Okay, never use the red pen. I started initially, but I will try my level best only to use at certain places, because in the exam also you will get an habit. Okay, so do not use red pen, avoid it, because it is, the examiner will also use the copy for the red color with the copy checking. So just stick to blue and black for headings and blue for the text. Okay, so I will try to make that consistent everywhere. Just to make things colorful, I'm using the different colors. So number one function, what is that? We have first function, that is protection. Okay, so in the sequence of importance of these functions, I am listing them. One is the protection. So how it is protection? So this skin is actually acting as a physical barrier. It acts as a physical barrier which protects the body from the pathogens like the bacteria, viruses, chemicals, and the physical injuries, right? So that is the first function, fairly easy to remember. Second function is regulation of body temperature, extremely important function, please do not miss. Regulation of body temperature. Now the skin helps to regulate the body temperature through sweating and regulating the blood flow to the surface. Okay, so this is via sweating, okay, and also the blood flow. Okay, then third point we have, that is the sensations, very important. Whole neuroanatomy is stuck on this, sensations. So what are these? So skin contains the receptors. Okay, so it has certain receptors, okay, which will detect the stimuli, right? And what are these stimuli which I am talking about? That is the pain, touch, pain, touch, pressure, temperature. Okay, so all these, and we will be talking about them in detail in the neuroanatomy section in the later part of the classes, where we will discuss the different neural pathways which are involved for carrying these sensations. Okay, so you will get better understanding at that point of time. So number 4 we have, that is the excretion. Excretion. Now excretion, so how? The sweat glands will help to eliminate the waste products. Okay, sweat glands help to eliminate the waste products, and that is something which we will read more in detail eventually, such as in dermatology also. The acne or the pimple are very common on the face. So just to prevent that, what you can do, you can maintain cleanliness of your face plus avoid applying any cold creams. Okay, on the contrary of the advertisements they do, because cold creams, what will they do? They will block the sebaceous glands, sweat glands in this face area, and that can lead to acne. Okay, so that is something which you will hear later. Then number 5 we have the immune defense. Immune defense. Now skin actually hosts few immune cells also. Number 6 we have the synthesis of vitamin D. Synthesis of vitamin D, extremely important. Again, vitamin D, as you might be knowing, it is produced by the skin when it is exposed to sunlight. Okay. When it is exposed to sunlight. And nowadays, if you will check the blood profile, most of the people have low vitamin D, because most of them are sitting inside indoors playing games, doing on computers. They are studying also. Okay, but they are not outdoors playing games. Even the children nowadays, they do not go outdoors to play sports activities. So times are changing, and so are the diseases also changing. Okay, so you can advise them a minimum of 10 to 15 minutes of daily exposure to sunlight. That is minimal essential criteria to produce vitamin D to an optimal level. Then last function, that is the absorption. Absorption. So skin actually absorbs certain substances, such as the medications. Certain medications are given to the skin, just ointment. Okay, such kind of things. Certain chemicals are also there under specific conditions. So primarily these are the main functions of the skin which you should be knowing. Okay, then let us come on to the types of skin. So here we have two types, that is the thick skin and thin skin. Okay, so skin has two types, and this is something which is asked you in the theory also and viva also. Thick skin and thin skin. So the thick skin is the thick layer of epidermis, obviously. Okay, and this is depending upon the basis of thickness only, obviously, right? So the epidermis, in case of thick skin, which I am referring to, it shows the thick stratum corneum. Okay, so you can write the thick skin, it has thick stratum corneum. We will discuss the layers in a while. Okay, and this thick skin is also known as glabrous skin. Okay, you may or may not remember, that's an extra thing. Then the thick skin does not have hair. That is very, very important and the most differentiating feature. So let me highlight this here only. Hair follicles are absent and present in these two case scenarios. Okay, so this is the most important difference which you should be remembering out of the all. absent and present hair follicles. Okay. So the hair follicles, I can say they are not present in the thick skin. Okay. So what will be the examples for the thick skin? You can correlate the skin of the palm and sole. पाम में यहाँ पर कोई हेयर फॉलिकल्स नहीं है, इजी टू रिमेंबर, इसमें रटना नहीं है, और ये मोटी चमड़ी है. ठीक है, इट इज थिक स्किन. सिमिलर इन द सोल. ओके, in the lower limb. So you have easy to remember, and skin everywhere in the body except the palm and sole. So example or hair follicle is quite an easy example to remember, I can say, right? So this is the location. The location that is important. The hair follicles is important. Okay. Then the another difference, in the thin skin, the epidermis is thin, obviously. Okay, the thin skin shows hairs. Okay, so I can write a word here, thin skin, or I can write hairy skin, right? So the skin covering all the parts of the body except palm and sole. Okay, so that will make the difference here. Rest of the differences you can just see, have a look. Stratum lucidum is present in thick skin, absent in thin skin. Thickness we have discussed. Epidermal ridges are present in the thick skin, the epidermal ridges, okay, elevations. Then erector pili muscle is absent, hair follicles are absent, erector pili muscle is absent, sebaceous glands are absent. Okay, so these three things are absent only, okay, in the thick skin, and they are present in the thin skin. So this is easy to remember. Okay, then sweat glands are more in case of thick skin, so here you would get more sweaty hands. Okay, so sensory receptors are even more, Merkel receptors, we will discuss that. That is more in the thick skin, less in the thin skin. Okay, so that is the gross differences which you should be writing for the thick versus thin skin. I hope it is clear to you. So next we come on to the structure of the skin. That was also in the competency, if you remember. So the competencies, so this skin we are going to discuss the structure of the skin. Okay, so now I told you in the beginning itself, the skin consists of two layers. Okay, the epidermis and the dermis. Okay, and the epidermis is the superficial layer that consists of keratinized stratified squamous epithelium. Okay, let me write it. So it has two layers, the epidermis and the dermis. Primarily speaking, these two only. Okay, so epidermis, it is the superficial layer, obviously, and it is having the keratinized stratified squamous epithelium. Now you might be wondering, what is this medical jargon? Okay, right now you have not read about the epithelium because histology has not been done, but eventually it will be done, and this epithelium is the most easy one out of the entire epitheliums which you will read in the entire human body. So don't worry on this, you will get to know about it very soon. And dermis is the deeper layer. Okay, this is the deeper layer, and this is made up of connective tissue. Again, connective tissue also we will study in the histology separately later. Okay, so I can say if we are talking about the epidermis first. So epidermis has the first layer, that is the keratinized stratified squamous epithelium. So this epidermis, classically, which is to be remembered, it consists of 5 layers of cells. Okay, so please remember this. Epidermis, it has 5 layers of cells. What are these? Let us see. 1, 2, 3, 4 and 5. Okay, 5 layers. Okay, so first one is the stratum basale. ठीक है, or I can write in the opposite manner, that will be much more easy for you to recollect later. Stratum corneum, ठीक है, stratum corneum. Then you have stratum lucidum, and then you have stratum granulosum, okay. Then we have stratum spinosum, and then we have stratum basale, ठीक है. Now classically important thing to understand and remember, this is corneum, ठीक है. So classically important thing to remember here is that stratum lucidum is present only in the thick skin, as we discussed previously. Rest of them are common, ठीक है. So this is something extra point for this. Another thing, mnemonic. I am not a very fan of mnemonics, but in certain places mnemonics do help, and only there I will let you know the mnemonics. I will not keep on making up unnecessary mnemonics which may be given in your textbooks also. So stick to the ones preferably which I am discussing, that is more than sufficient to remember. So mnemonic here follows is the C L G S B, okay. So classical mnemonic to remember C L G S B, ठीक है. You can remember this with the help of this mnemonic, okay. So stratum lucidum is the one which is present only in the thick skin. This is important, and if it is present in the thick skin, in that case it lies between the stratum granulosum and the stratum corneum, okay. So easy. So next we come on to the stratum basale first, okay. So let us discuss them one by one. The stratum basale okay. So stratum basale is also known as stratum germinativum, okay. So this is the other name, stratum basale, ठीक है. So this is the first layer which we are talking about, okay. So this stratum basale, as you might be understanding, this is the deepest layer, okay. This is point number one, that it is deepest layer, okay. So this deepest layer, it consists of a single layer of cuboidal cells, okay. Single layer of cuboidal cells, or I can say better, low columnar cells. In certain textbooks you will find this written, low columnar cells. Again, the type of epithelium will be discussed eventually in histology, so it will come clear, don't worry on that, okay. I am not going to go into detail of histology right now. So this single layer of cuboidal cells, this actually rests on the basal lamina, okay. So this one, this layer of cells, it rests on basal lamina, okay. So very important point to remember in this layer, that this layer, it contains the melanocytes, and mechanoreceptors, okay. So these cells, they will show the melanin pigment, About this pigment also you will read upon later in detail. So this is one thing which actually gives the color to the skin also, and these cells they divide mitotically to give rise to keratinocytes, which are the cells of the skin. Okay, so stratum basale actually is doing this only, that this layer of the cells they are dividing. Okay, divide to give rise to keratinocytes. Okay, keratinocytes, which are the cells of the skin. Okay, and these forms the superficial layers of the skin. Hence, that is the reason why this stratum basale is called as stratum germinativum. Okay, because वो germinal layer की तरह, it's acting as a germinal layer kind of thing. Okay, so that is about the first layer, that is stratum basale. Next we talk about the second layer, that is the stratum spinosum. Stratum spinosum. See, we need to know few things, important points about each layer. Okay, that would be more than sufficient. So this stratum spinosum is also referred to as Malpighian layer. Okay, Malpighian layer भी कह सकते हो. Malpighian layer, also known as prickle cell layer. These are all your MCQs actually. ठीक है, so next की तैयारी भी हमारी हो रही है साथ साथ में. Okay, even the prof university exams also they ask MCQs, if you are aware. ठीक है, so this is the second layer in picture. So this is lying just above the stratum basale, right? So this is just above the stratum basale, I can say. Okay, what else? It is several layers thick. It is several layers thick, and keratinocytes of stratum spinosum, they are actually polygonal in shape. The keratinocytes, now you know the name keratinocytes. Here these keratinocytes are polygonal cells. Okay, they have this polygonal shape. Okay, and they are connected with adjacent cells with the help of desmosomes. Connected with cells by desmosomes. Now what is desmosomes? Desmosomes is actually nothing but a junctional complex. Okay, so there are supposed my hand you can see right now. So two cells are placed close to each other. Okay, so there will be certain complexes running between the two cells which are holding them in place. Okay, so those are known as junctional complexes. Certain textbooks of histology they mention as cell to cell talk. So now there are certain things, certain junctional complexes which are not only between the different two cells, adjacent cells, but also in the basal layer and the cells. Okay, so this is the apical surface, this will be the lateral surface of the cell. Okay, and then there will be the basal surface. We will come to that in histology in detail, but just telling you a brief point here. So certain junctional complexes are holding the cell layers itself, okay, together. So this is desmosomes, which you can remember here. Now why this is known as spinosum? Okay, so you can see they are known as prickle cell layer भी कह रहे हैं ना इसको, we are labeling it as prickle cell layer. ठीक है, prickle cells. Okay, so spines over the cell surface, as you can see. Okay, so what is this? So spines are nothing but the artifacts. Okay, so the prickle cells, that's during the preparation of the tissue for sectioning, the cells they often shrink. Okay, but what happens to the keratinocytes, the prickle cells? Okay, so these are the prickle cells, keratinocytes here. Oh, This is the keratinocytes and this is the prickle cells. Okay, so they are the same thing which we are discussing here. Okay, so these keratinocytes or prickle cells, they remain adherent with each other at the site of desmosomes. So this creates spines over the surface of the cells at the site of desmosomes. Thus the keratinocytes in this layer will show very small spine like projections on the external surface. That is why we are saying it as prickle. ठीक है, कांटे की तरह. Okay, so this is the second layer which we are talking about. Then you have layer number 3. Layer number 3, that is a stratum granulosum. ठीक है, stratum granulosum. Now this stratum granulosum, as you can see, let me highlight here, this one is the granulosum which is shown here. ठीक है, so this consists of 1 to 3 cells thick layer of keratinocytes, 1 to 3 layers of keratinocytes. ठीक है, so the cells of the stratum granulosum, they will contain the granules of keratohyaline protein. Okay, so these cells, they contain the granules of keratohyaline protein. ठीक है, therefore the name given to this layer is stratum granulosum. ठीक है, and keratohyaline is nothing but a precursor. This keratohyaline protein, this is a precursor of filaggrin protein. ठीक है, ये कभी कभी MCQ आ जाता है, so just be aware of this. Okay, filaggrin protein, this filaggrin protein actually is the one which forms aggregations. Okay, so on aggregations it will form the keratin filaments. Okay, so you can write it aggregates to form the keratin filaments. ठीक है, so this is about the stratum granulosum. Then we come on to the layer number 4. The layer number 4 is stratum lucidum. Okay, now lucid, जो कि it is my job to make this anatomy subject for you. Lucid means clear. ठीक है, और हैंडराइटिंग भी मेरी क्लियर होनी चाहिए. lucid हैंडराइटिंग कहते हैं. Fonts, अगर if you go into fonts in the MS Office, you can find the lucida handwriting. Okay, that is the font also which is available in the computer. So lucida means clear. Okay, so lucidum, this is stratum lucidum. Now this is present only in the thick skin, a very important point which will fetch you the maximum marks here. It is present only in thick skin. ठीक है, number first point. The cells of the stratum lucidum, they are strained very lightly with eosin and they appear homogeneous. Okay, and their cell boundaries are indistinct, and the nuclei, the cell organelles, all this thing, if you just see in this image for a second, just focus on this layer. Okay, let me just zoom in. Can you see this layer which is quite very much evident and visible here? Okay, this one, this layer. So this appears, it is lightly stained with eosin and appears homogeneous. Okay, very important. हम कुछ भी, we are not saying but we can't see. Okay, so we can see everything. Stratum lucidum, this appears this is appearing as lightly stained with, it is lightly stained with eosin. Okay, and it appears homogeneous. ठीक है, and their cell boundaries, they are indistinct. The cell boundaries are indistinct. We cannot make about what are the boundaries of the cells. Okay, we cannot distinguish between the different cell boundaries. ठीक है, and the nuclei and cell organelles, they become disrupted and they disappear towards the superficial layer. Okay, so that is the stratum lucidum. And the cells, very important point, let me write here only. The cells of the stratum lucidum, they contain something known as elidin. स्पेलिंग देख लो, elidin. ठीक है, so this is elidin. What is elidin? It is a clear intracellular protein. It is a clear intracellular protein which is derived from keratohyalin only. Okay, and this elidin protein, this gets converted to keratin. Elidin gets converted to the keratin in stratum corneum. ठीक है, so this is another point to remember. And so this is about the stratum lucidum. Okay, and this is present only in the thick skin, and you know thick skin has no hair follicle. Extremely important point to remember again. Okay, these are certain viva questions which you can remember. Okay, right, so then we go on to the layer number 5. Layer number 5, that is the stratum corneum. Now this stratum corneum, which you can see in this image again, this is a topmost layer. Okay, we have discussed a little bit about it already. This stratum corneum is the most superficial layer of epidermis. पहला तो ये point हो जाएगा, most superficial layer. ठीक है, the cells of the stratum corneum, the cells are non-nucleated. Very important point, non-nucleated, flat and scale like, or I can say squamous cells. ठीक है, and they are actually dead cells. So न्यूक्लियस नहीं है तो डेड ही होंगे. ठीक है, एंड दे डू नॉट हैव एनी नो सेल ऑर्गेनेलीज. ठीक है, सो दीज आर सर्टन स्पेसिफिक पॉइंट्स अबाउट द सेल्स ऑफ द स्ट्रैटम कॉर्नियम. नॉन न्यूक्लिएटेड होगा, स्क्वामस सेल होगा, फ्लैट होगा ऑब्वियसली, डेड सेल हो जाएगा एंड सेल ऑर्गेनेली कोई नहीं होगा इसमें. ठीक है, सिंपल. Important है ये सारे से कुछ, that is why I have highlighted. Okay, so the cells of the stratum corneum, they are filled with keratin filaments again, which we discussed previously also. Okay, so these cells are held together by extracellular lipid and carbohydrates which form a glue like substance. Okay, and the extracellular lipid, it makes the skin impermeable to water. Okay, so please remember this. The extracellular lipid, okay, which we discussed, this makes the skin impermeable to water. Okay, simple. And the thickness of the stratum corneum, it depends upon the amount of friction to which the skin is exposed. Stratum corneum is very thick, as we discussed, in the palm and soles, and superficial cells of the stratum corneum, they are being constantly shed off and they are replaced by the proliferation of the which layer, if you remember, that is the first one which we discussed, stratum germinativum. Okay, so that is about this. Then another thing, some interesting facts which I told you, the skin is actually the largest organ of the body. We discussed this. What else? This is only this palm and the sole, they have the thick skin in the body. The face is the commonest site of skin cancer. Okay, moles, if you have heard massa, mole, they are the commonest congenital disorders in the skin. And the thickest skin of the body, that is in the upper part of the back. If you will do the dissection eventually in the upper limb, you will see the back region, it is quite thick skin and moti chamdi jise kehte hain, theek hai. And here the thin skin covers extremely thick dermis. Okay, so that is the difference. Okay, so here we have the layers of the skin. So before I proceed any further, let me show you in 3D also. We have a beautiful model which will help us to understand this. Skin. Okay, we have a separate model which was released recently only by the application. So you can see this is the skin layers they have shown. This is the superficial layers of the epidermis. You cannot differentiate between them here. So these are the superficial layers. Then you have the deep layers of the epidermis. Okay, then you can see the epidermal ridges are shown here. Okay, these are the ridges. Then you can see this is the cortex with the hair follicle. Actually they have shown the hair follicle. Okay, so this one, external root sheath, if you can see here. Okay, I hope it is clearly visible. And you can see the muscle attached to it, that is the hair follicle attached, that is the erector pili muscle. Okay, which is attached to the hair follicle, you can see very well. And then you can see the different nerves. Okay, in this layer, this is the papillary layer of the dermis. We will come eventually to this. There are two layers of the dermis, papillary and the reticular. Okay, so this is the papillary and reticular layers. And then you can see the subcutaneous tissue below, and you can see a lot of structures. Okay, if I just remove this, you can see a ton of structures within these layers. Okay, we will come to that also eventually. You will get to know the main ones. Okay, not all are important, few things are important, like you can see the lamellar corpuscles are visible here. This is the apocrine sweat glands which is shown here. Okay, this is a sweat gland they have shown. Let me just remove it, maybe if I can see. Okay, we can see the internal, all the things which are visible. Okay, so this is a good model to understand that there are different layers of the skin. So you can see here also, this is the sebaceous gland. Okay, so sebaceous gland secrete in the sebum. Okay, oily secretions. This is the classical hair shaft which you can see. Okay, the hair is coming out onto the skin surface. Okay, so you know there are certain clinical entities like the hair follicles can get infected. Okay, so that can also be leading to a problem, folliculitis, you might have heard of. Okay, so we will come to that eventually when we will discuss region wise also. So this is the model for this skin. Okay, so next we come on to the important clinical integration. Okay, for this skin, what we have discussed. See, just to tell you here a simple thing, that my personal opinion for the entire subject of anatomy is that it's without clinical anatomy, it's not a subject to remember, because otherwise everything is highly volatile. If it doesn't apply clinically, then what's the point of learning all this information? So whatever in my classes I will be teaching you the maximum clinical integration of every topic, from fetched from multiple textbooks put together in one place. If you will not find it anywhere else, I am damn sure about it. And the point is that certain textbooks mention 2 points or 3 points, certain mention 4 points or 5 points. Higher textbooks of anatomy, they mention even better. So if we club everything, trust me, at the end of the classes you will become a very knowledgeable person. You may not be remembering every entity obviously, but yes, you will be able to say that you have heard the entity at least. So that is more than sufficient in first year of your MBBS. We don't expect you to treat the disease. We just want you to remember the name of the disease and the basic underlying anatomical basis. So coming to the first one, that is the clinical integration of the skin chapter, which we have discussed till now. The number one thing before we discuss, that skin of the eyelid is the thinnest skin of the body. Okay, it is devoid of fat also. That is an extra point you can remember. The cutaneous route for drug delivery, that is also followed, like the lipid soluble drugs, they are absorbed by the skin. Okay, so you can write this. Point number one, here we have the cutaneous route. Cutaneous means skin only we are following. Okay, cutaneous route of drug delivery. Okay, cutaneous route of drug delivery. So this involves the classical lipid soluble drugs. Okay, so the lipid soluble drugs, they can be absorbed by the skin. Classical example you might have used also, that is the various ointments which we apply on the skin surface. Okay, if we have a cut or wound or anything, ointment. Then the sprays. Okay, the painkiller sprays also. Okay, then we have certain patches. Okay, certain patches which are used. Okay, so ointment, sprays, patches, all these are utilizing this cutaneous cutaneous route of drug delivery. Then the mammary gland itself. The mammary gland or the breast tissue, this is actually, you will be surprised to know, this is the modified sweat gland only. इस पे क्वेश्चन आता है MCQ. This is a modified sweat gland in females. We will take it up in detail structure wise in the upper limb. Okay, then the third point, that is the basal cell carcinoma. Basal cell carcinoma. So now basal cell carcinoma, what is this? This is the most common skin cancer. Number one. So it can arise from the trichoblast or folliculo-sebaceous apocrine germ. Okay, so it begins as painless skin elevations. Starting में this begins as painless skin elevations. Okay, and it rarely can metastasize. Okay, or what is metastasis? That is, it spreads to distant locations. Okay, so it can rarely metastasis. ठीक है, metastasize. Okay, to distinct locations. And this basal cell carcinoma, I told you in the beginning also, this occurs in the hairy skin. Occurs in the hairy skin, and this I'm talking about mostly on the face. Okay, I'm writing behind my video also, because PDF you will be getting anyhow, and I'm speaking also in case you are writing side by side, you can write. Okay, I don't want to waste the page space actually. Okay, my notes are quite a planned manner. You will get to know eventually in all the classes. It's not haphazard, I will be keep on writing anywhere. I plan it out everything before the class and I write it exactly where I have intended to. Okay, so I don't want to waste the space of the pages. So I hope it is acceptable to you also. Then you have the another thing, that is a squamous cell carcinoma. Squamous cell carcinoma. Okay, this is also referred to as epidermoid carcinoma. Epidermoid carcinoma. Okay, so what is this? This arises from the squamous cells of the skin and the part of respiratory tract, gut also. Squamous cell carcinoma usually arises in the sun exposed parts. Very important. Arises in the sun exposed parts. Okay, to be more specific, UV exposed. Okay, ultraviolet rays of this sun. Okay, UV light exposed part, and this occurs mostly in the older people. Okay, mostly in the older people, and mostly on the face, ears, and scalp, lips. Okay, all these places it occurs. Okay, so that's about the skin initial clinical integration which we discussed. Next we come on to the next layer, that is the dermis. Dermis. Okay, now dermis is a deep vascular layer of the skin. First point to remember, it is a deep vascular layer of the skin, and this is made up of connective tissue containing collagen bundles, blood vessels, lymphatics, nerve fibers. It also contains erector pili muscle, we saw on 3D also. Okay, we have seen this in 3D. Okay, we have seen in 3D, and it also contains the erector pili muscles, the hair follicles. Now dermis has two layers. Okay, what are these two layers? Number one, that is the papillary layer, or I can write better, superficial papillary layer, so that we remember कि ऊपर वाली papillary है. ठीक है, superficial papillary layer. So this lies deep to the basal lamina of the epidermis. Very important. Deep to the basal lamina of epidermis. Obviously ना, epidermis ऊपर थी तो epidermis के नीचे तो है dermis. ठीक है. This consists of again loose connective tissue. It shows finger-like projections into the under surface of the epidermis, and these are known as dermal papilla. Dermal papillae. ठीक है, dermal papillae highlight कर लो, important है. Okay, and then the epidermis also protrudes into the dermis. Okay, so epidermis protrudes into the dermis. Okay. Epidermis protrudes into the dermis, and this is in the form of एपिडर्मल रिजेस, ये नाम सुना था हमने, एपिडर्मल ridges, we saw on 3D also na, epidermal ridges. Now these ridges are also known as rete ridges, also known as retepegs. ठीक है, retepegs, इस पे MCQ आता है. retepegs are present in which layer of the skin? ओके, इस तरीके से क्वेश्चन बनता है. सो retepegs और rete ridges और एपिडर्मल ridges एक ही बात है, और ये नाम से पता लग रहा है एपिडर्मिस का प्रोट्रूजन है. ठीक है, इनटू द डर्मिस. So the dermal papillae and epidermal ridges, so these are the two main things. They are longer in the skin where the mechanical stress is more. For example, the skin of the palm, the skin of the hand. So all the dorsum of the hand, skin of the skin over the palm and dorsum of the hand, this has more of these because there is more mechanical stress. ठीक है, so these two, they are longer where the mechanical stress is more. Okay, then we have number 2 layer. That is the deep, okay, that is a deep reticular layer. Okay, now this deep reticular layer, very important classically. This deep reticular layer is the one which lies deep to the papillary layer, and it is having dense irregular connective tissue. Again, we will discuss that separately, dense irregular connective tissue. ठीक है, now this is thicker and less cellular, very important. It is thicker and less cellular as compared to than the papillary layer. ठीक है, please mark it as important again, thicker and less cellular. Okay, so this consists of thick irregular bundles of type 1 collagen fibers and elastic fibers. Okay, next we come on to the entity that is known as Panniculus carnosus. We will read about this eventually again in the head and neck region also. ठीक है, so now what is this Panniculus carnosus? Actually it is very interesting. Okay, you will keep on noticing these things now when you will be reading about them. Your eyes see what your mind knows. Okay, otherwise you will ignore it even if you see it. So what is this? It's a part of subcutaneous connective tissue. Number 1, it's a part of subcutaneous connective tissue. Okay, so now this Panniculus carnosus, this actually consists of a layer of striated muscles. Okay, it consists of a layer of striated muscles just deep to the subcutaneous fascia, or I can use the word hypodermis if you remember. Okay, hypodermis. Now this is very well developed in lower animals. Okay, so now just remember you might have seen a cow or a buffalo in your nearby locality. On the hump of the cow or the buffalo, you might have noticed the flies or mosquitoes or sparrows, something sitting. How does the cow or buffalo shake it off? The muscles, they twitch up. Okay, so that is the Panniculus carnosus, which helps the lower animals to make the flies, mosquitoes and insects away from their body. Okay, I'm not talking about the dog, which actually it does shakes his entire body to shake off the water. I'm not talking about that. I'm talking about the simple muscle twitching which happens on the hump of the buffalo or hump of the cow or the lower animals, even all the cat family, all the animals. So that is the utility in the lower animals. So now as humans have developed, so that muscles have, surprisingly, those have come to the face. Okay, so you make tons of expressions in 10 seconds due to the usage of this. So suppose we will discuss in the face chapter in the head and neck, all the muscles of the facial expression are attached to the skin. Okay, they are not attached to the underlying bone except one, but they are attached to the skin surface. That's why how we are contracting the muscles, the skin wrinkling happens and we can make happy face, sad face, or I don't know what your face is right now. I cannot see you, whether you are happy or irritated, or I don't know what's your mindset right now. So that is an example which you have to remember. Okay, so classical example in humans. We are discussing humans. अब वो टाइम चला गया botany zoology का. Now we are only focused on humans. ठीक है. So in humans, what are the classical examples which you need to remember? The muscles of facial expression. Okay, muscles of facial expression, which you will read in detail. There are lots of muscles. Okay, including the platysma. All these muscles are useful for facial expressions. I can show you in a quick recap. You can feel interested in the topic. Just have a look. If I just bring the muscular system here, so these are the different kind of muscles which you can see on the face. They are responsible for the day-to-day facial expressions, and they all are examples of Panniculus carnosus. Okay, so you can see around the eyes you have this orbicularis oculi, orbicularis oris around the mouth. Around the nose you have this nasalis muscle, you have this alar part of the nasalis muscle. Okay, so all these muscles we will study in detail. So there is another muscle which you can see here, which I want to show you. Actually, this is the levator labii superioris, and there is this muscle which you can remember. It's a very big name in the muscles. So similarly you have other muscles also. You have another muscle, that is the levator labii superioris aliquae nasae. This is one muscle. Okay, but the muscle is very small, the name is very big, the longest name of the muscle in the face in the entire human body. So you can kind of tease your non-medico friends that we have to learn so many different things. So then what else apart from muscles of facial expression? You have the muscle that is the palmaris brevis in the hand. Okay, then number 3, you have the classical example dartos muscle in the scrotum in the males. Okay, so this is about the Panniculus carnosus, which you should be remembering. So before we proceed further, just a recap. So skin had epidermis, dermis, एपिडर्मिस में स्ट्रेटम बेसेल which was single layer of small columnar cells or low columnar cells. Stratum spinosum, prickle cell layer having spinous processes several layers thick. Stratum granulosum, 4 to 5 cell layer thick, contained keratohyaline granules. The stratum lucidum, which was present only in the thick skin, translucent layer, dead cells are present in this. Stratum corneum, which is 15 to 20 cell layer thick, again cells are dead, no nuclei or cell organelles. Then we discussed about the dermis, which had the superficial papillary layer and deep reticular layer. The superficial papillary layer showed dermal papilla, okay, dermal papilla, and the deep reticular layer, it shows irregular dense connective tissue, okay. Even the papillary layer had epidermal ridges or retipex or retiridges, okay. So these are the simple things which you should remember. Then we come on to the next heading, next topic, that is the cells of epidermis. Okay, the cells of epidermis. So now what are these cells? You can see this very beautiful image understanding them. Okay. So number one, see, there are total skin has actually 4 kind of cells, okay. So the keratinocytes, melanocytes, okay, the Langerhans cells, the Merkel cells, okay. So you can see few of them in this image, okay. So let me write somewhere cells. It has the 4 types. Of cells. Number 1, that is the keratinocytes. Number 2, we have the melanocytes. Number 3, we have the Langerhans cells. Langerhans cells. Number 4, we have the Merkel cells. Merkel cells, okay. So these are the main 4 types of these cells which you should be knowing, okay, in the skin. Okay. So number 1 cell, that is the keratinocytes. These are constituting around 85% of the total number of cells. Okay, so these are, I can say, predominant cell type. This is predominant cell type. The major functions of these cells, they include the production of keratin and the formation of the epidermal water barrier, okay. Formation of keratin and the formation of epidermal water barrier, ठीक है. So keratinization, what is keratinization? The keratinocytes, they synthesize the keratohyaline granules, and later the keratohyaline granules, they release the keratin filaments into the cytoplasm, and these filaments get aggregated with the help of filaggrin and trichohyaline proteins. This entire process is known as keratinization, okay. So that is something you can know. Then you have something known as melanocytes, okay. So this thing was visible here, yes. We have the melanocytes. Now melanocytes, they are the ones which are present in the stratum germinativum, or I can say stratum basale, okay, present in the stratum basale, ठीक है. They have dendrite-like processes, these melanocytes, and they synthesize the melanin. Okay, as you can imagine, as per the names, they synthesize the melanin and they transfer it to the other cells. Okay, then you have the Langerhans cells, the dendritic cells of the Langerhans cells. Langerhans cells, they are the one which are antigen presenting cells of the epidermis. Okay, so please remember, they are the antigen presenting cells, okay, of the epidermis. Okay, and they arise from the lymphoid precursor cells of the bone marrow. Okay, so they are derived from the lymphoid precursor cells of the bone marrow, and they are the ones which are lying in the stratum spinosum. Very important, and this has been asked as MCQ also. Okay, stratum spinosum. Okay, this was in the stratum basale. ये layers याद रखनी है, ठीक है, important है. Okay, so this is Langerhans cells, and they are the ones which are phagocytizing the bacteria and presenting the bacterial antigens to the T lymphocytes. So in AIDS, if you know AIDS, HIV AIDS, so in AIDS patients, the Langerhans cells may show the presence of HIV virus, and they can act as reservoir of HIV virus. Okay, so that is an extra thing which you can remember. So this is something to remember, present antigens to the T lymphocytes. Okay, then we have the cells of the Merkel. Okay, so Merkel cells, now these Merkel cells, they are the sensory cells responsible for the cutaneous sensations. Okay, so you can remember, these are the tactile localization, that is a function, classically important. So they are located in the stratum basale. Located in the stratum basale. Okay, and Merkel cells are the mechanoreceptors, which I just told you, mechanoreceptors, containing the mechanoreceptors. So they can they are useful for the blind people also. Okay, so sensory nerve endings, they are present in relation to the Merkel cells. These are more abundant in the fingertips, the oral mucosa, the hair follicles. So they are very helpful in case of blind people. Okay, so these are the something regarding the cells which we discussed. Okay. Okay, an extra point here to remember, that is regarding the entity known as psoriasis. Okay, so you will read about this disease eventually in dermatology postings. Okay, you will see this, what is it. So this is a skin disorder only. Okay, this is a skin disorder which shows a patch of the skin with the characterized by silver white flakes, or I can say scales. Okay, so this occurs, why this occurs, this is because of the due to the reason that is the rapid turnover of the keratinocytes. Okay, so that is approximately 8 to 10 days. Okay, so that is psoriasis, which you will see the patients also eventually. Okay, then you have something known as the color of the skin. Okay, so before I go further, let me just add here. We have the entity that is the color color of the skin. Okay. So now this color of the skin, it depends upon the presence of pigments. Okay. So what are the three pigments which are responsible? It is due to the presence of three pigments. Number one, that is the amount of melanin. Sorry. The amount of melanin in the epidermal cells. Number two, we have the carotene pigment. Carotene pigment. Okay, that is imparting yellow color to the skin. Number three, we have the vascularity. Of the skin, that is due to the hemoglobin content. Okay, you know anemia में pale हो जाती है skin थोड़ी सी, ठीक है. So I am highlighting here melanin, the carotene, the hemoglobin. ठीक है. So ये classically तीन है जो important है for the normal color of the skin. So the melanin, this is a brown pigment. Okay, melanin is a brown pigment. Okay, and is present in the melanocytes, keratinocytes of skin, pigmented epithelium of retina, pigmented cells of the vascular zone of eyeball. And then role of melanin is very important. The melanosomes, they acquire the supranuclear position in the keratinocytes and they protect the nuclei from UV induced damage. Okay, so this is very important. Melanin, this is protecting the nuclei. It protects the nuclei of keratinocytes from UV induced damage. Okay, so this is about the melanin. Talking about the carotene. Carotene is a yellow orange pigment. See, about the hemoglobin you will read in detail in the physiology and in medicine prof. Okay, that is a final year, but physiology maybe you will read about it. This carotene is a yellow orange pigment. It is taken from the food and it is present in the stratum corneum and the fat cells of dermis and superficial fascia. Okay, so these are certain things which you can remember. Okay, next we come on to the entity, that is the clinical integration. So number one entity which you will hear in your life and you will see the patients also, that is the albinism. What is albinism? It's an inborn error of metabolism which makes the melanocytes incapable of melanin synthesis. So this occurs due to the, it is lack of melanin synthesis due to the absence of enzyme which is the tyrosinase enzyme. Okay. Number 2 we have, that is the vitiligo. Vitiligo occurs due to the destruction of melanocytes again because of the autoimmune reactions. So this produces a classically known as the patchy depigmentation of the skin. Okay, patchy depigmentation of the skin. Next we have moles. Number 3, that is the moles, which are dark, slightly elevated massa, which are flat lesions of the skin. They are present almost in all individuals, either in birth or appear later in life because of the hormonal influence. Number 4, that is the malignant melanoma. Malignant melanoma. See, dermatology is a different stream altogether. So possibly I cannot show you everything and discuss everything, but most of the important things which I expect you to remember as per clinical integration, I am writing them. So malignant melanoma is an invasive tumor which arises from melanocytes again. It is spreading locally or throughout the body through the blood or lymphatics, and this can occur because of excessive exposure to the sunlight. So that is malignant melanoma. ठीक है, नाम से पता लग रहा है melanocytes का involvement हो रहा है. So then we come on to the surface patterns of the skin. ठीक है, the surface patterns. Now what are these surface patterns? Classically there are 3 types of surface irregularities. Number 1, that is the tension lines. Number 2, we have the flexor lines. And number 3, we have the papillary or the friction ridges. Okay, so the cell surface patterns, which includes the flexor lines, as you can see in this image. Okay, so these are classically, as you can appreciate, the proximal wrist crease, the distal wrist crease. Okay, so all these are palmar creases which you can see in your palm. So they can be flexor lines, they can be flexor lines or flexor creases, they can be acquired permanent lines or creases in the skin. Okay, then you have the tension lines, that is the Langerhans lines. Okay, so this one is cleared. So this one, as you can see in this image, so these lines, they are representing the, it represents the cleavage lines, or I can say better, the Langerhans line. Okay, Langerhans lines in the skin of the face. So these are nothing but tension lines only. Okay, these are tension lines. ठीक है, Langerhans lines और cleavage lines, वही हमारी जो फर्स्ट है कंडीशन. ठीक है, so these are flexor lines or flexor creases. ठीक है, so here we have the tension lines. So then you have something known as the papillary or the friction ridges. ठीक है, so papillary or friction ridges, so the skin along the flexor lines, it is completely thin and firm, bound to the deep fascia. So the papillary ridges, which you can see here, the papillary ridges, or I can say friction ridges. Okay, so these are present on the fingers, toes, palms, soles, and they are narrow ridges which are separated by parallel grooves. Okay, so these are also used for identifying the individuals. Okay, so this is useful for identification. you will read more in detail in the forensic medicine. Okay, so this branch is known as dermatoglyphic. Okay, so there are basically 4 patterns: 1, 2, arches, whorls, loops and composite pattern. Okay, so there are 4 patterns. Okay, 4 patterns in the digits, and these are one which comes under the term that is used as dermatoglyphics. Okay, dermatoglyphics. So this is useful for identification of the individual. Okay, so you will read about more in detail in the forensic medicine. I am not going to detail here. So then we come on to the clinical integration, that is the stretch marks or the linea albicans. Okay, so there is another entity which you will read about, that is the stretch marks or linea albicans. Okay, it appears due to overstretching of the dermis. This can occur due to the rupture of the collagen fibers, and they repair with the, it can happen due to the rupture of the collagen fibers, and this can repair with the scar tissue. Okay, so it is commonly observed in the lower part of abdomen, buttocks, thighs, breasts of multiparous females. Okay, the ones which have undergone multiple pregnancies. Then you have second one, that is the one more thing, the skin incisions, they are made parallel to the tension lines of the Langer because they heal with least scarring. Okay, that is also a point to remember. Tension lines is very important. Then you have the wrinkle lines. ठीक है, टेंशन लाइन्स हमने लिखा था कहीं, हाँ. So this is also important, which I told you. Then you have wrinkle lines which are produced by contraction of the underlying muscles. So they can be perpendicular to the lines of the muscle pull. Number 3, we have the lines of expression. Lines of expression. So the furrows or the lines on the forehead, the face, they are produced due to the continuous contraction of the muscles of facial expression. Okay. Then you have number 4, that is the fingerprints. Fingerprints, I told you the other name is dermatoglyphics. So every individual has a different unique fingerprint pattern. The, iPhones have had the fingerprint sensors also, even the Android devices they have. Nowadays Face IDs has come into picture. So the fingerprints are very useful for medico-legal purposes, okay, to identify the criminals. Useful for medico-legal purposes. Okay, and to identify the criminals. ठीक है, इसने चोरी करी है और भाग गया, तो यू कैन गेट द फिंगरप्रिंट्स, पिक्चरों में देखते हो, वेब सीरीज में. टू आइडेंटिफाई द क्रिमिनल्स एंड आइडेंटिफाइंग द, ऑल्सो टू आइडेंटिफाई द जेनेटिक डिसऑर्डर्स. ठीक है, जेनेटिक डिसऑर्डर्स, the mental disorders and predicting the disorders, all these things are useful. Okay, so these are all the clinical integrations. Clinical integration. Okay, so talking about the next, that is the another thing. There is another disease. Yes, clinical integration में add करते हैं यहाँ पर. Before I move to this, number 5, there is a disease that is known as pemphigus. Okay, pemphigus is a rare blistering autoimmune disease which affects the skin and mucous membranes. Okay, So it's a rare blistering autoimmune disease of the skin. ठीक है. Then you have the pemphigus की varieties भी हैं. pemphigus vulgaris होता है एक, ठीक है, which is again a blistering skin disease characterized by formation of autoantibodies against the desmosomes. ठीक है, so that is pemphigus. So then you have skin cleavage lines in the case of pemphigus and bullous pemphigoid. So that all things you will study more in detail regarding the pemphigus vulgaris, the blisters, okay, at any epidermal level. So this you will read more in detail in the dermatology. Okay, so next we come on to the skin sensory receptors of the skin. Sensory receptors of the skin. Okay, so we can see here the sensory receptors of the skin. Skin is enriched by free nerve endings. Okay, we have the free nerve endings. The free nerve endings. Then we have the Paxinian corpuscles. Okay, and these free nerve endings are for fine touch. You can see all these sensations. Then you have Paxinian corpuscles for deep pressure and vibration. Then you have Meissner's corpuscles for light touch. Merkel disc we have already discussed, mechanoreceptors. Ruffini's for stretch and torque sensations. Then end bulb of Croce for cold temperature. So you will read all these things in much more detail in the physiology. Okay, then we come on to the skin appendages. Okay, in this let us see this image. So appendages we have already listed. What are those? That can be the hair follicles, hair, nails, sebaceous glands, eccrine sweat glands, apocrine sweat glands. So talking about the nails first. So you have the nails, which are modified zones of epidermis found on the dorsal surface of the tips of the fingers and the toes also. Okay, so they contain corneocytes. Okay, so they contain the corneocytes. They contain corneocytes. ठीक है, so they are non-nucleated cornified cells which form the nail plate. ठीक है, so these are non-nucleated dead cells होते हैं. So nail they consist of a very tough protein which is it contains a tough protein which is known as the alpha keratin. ठीक है, high sulfur content of the keratin is responsible, please remember, high sulfur content of the keratin, this is responsible for the hardness of nail plate. ठीक है, actually there are many disorders which are linked to the nail plate. ठीक है, अगर पतली हो जाएगी तो ही प्रॉब्लम है. सो हार्डनेस मेंटेन करना इज वेरी इंपॉर्टेंट. ओके, सो द नेल shows certain parts as you can see here. I'm highlighting them. Number one, that is the nail plate. Nail plate, that is the body. Okay, this contains the keratinized cells. The nail plate shows a free distal end, okay, and distal end, and the embedded proximal end, which is the root, or I can say the radix part. Okay, then you have the nail bed. Now this is a highly vascular connective tissue layer which lies deep to the nail plate. ठीक है, the germinal matrix is the thickened germinal zone of the nail bed at the root of the nail plate. Okay, so then you have a proximal nail fold. Okay, proximal nail fold, which is a fold of epidermis which covers the nail root. Okay, somewhere here in this region. Okay, this is the proximal nail fold, this one. Okay, so there can be lateral nasal folds, lateral nail folds, which will be the nail walls, and then lateral nail grooves. Okay, then you have something known as the lunula. Okay, number 3, that is the lunula. Lunula is a proximal soft, you can see here in your nails also, if you can find clearly, there will be a circle kind of, semicircle kind of thing, a proximally located, I hope you know proximal and distal, है ना, proximal soft half moon shaped white area of the nail plate which overlies the germinal matrix. Okay, so that is the lunula, as you can see in this image also. Then you have something known as eponychium. What is eponychium? It is extension of the base of the nail plate or the stratum corneum deep to the proximal nail fold. ठीक है, so यहाँ पर you can see, I can label it better, number 5 इसको label कर देते हैं. This is the proximal nail fold. ठीक है, proximal nail fold. Okay, this one. So then you have this, that is the eponychium. Okay, I told you eponychium, that is the extension of the base of the nail plate. So then there is something known as hyponychium. Okay, also eponychium है तो hypo भी होगा, hypo. Hyponychium is the part of the stratum corneum epidermis that lies under the free edge of the nail plate. Okay, so there is number 5 entity, that number 6, that is the hyponychium. Okay, so it is again part of stratum corneum only, but it is under the free edge of the nail plate. Then you have something known as perionychium, which contains the nail wall in the cuticle area. Cuticle is the skin that overlies the base of the nail at the matrix. ठीक है, so nail matrix दिख रहा है, that is the place where the skin is present overlying that part, that is the cuticle. ठीक है, so cuticle को clean करना बहुत ज़रूरी है if you have got done the manicure pedicures. So cuticle एक चीज़ है, so number 7 entity लिख देते हैं हम इसमें, that is the cuticle. ठीक है, cuticle हो गया हमारा. ओके, so growth of the nails, it is depending upon a lot of factors. So proliferation of the cells of the nail matrix, it produces continuous nail growth. And I hope you know the growth of the fingernails, that is the fingernails, that they grow approximately 1 mm per week. ठीक है, this is faster than toenails. ठीक है, this takes 3 to 4 months for the whole nail to grow. For whole nail to grow. So if you have got an injury and if the nail is removed, so it can take up to 3 months to get the entire nail grown again. Okay, so if you are removing the nails infected with fungus, so treatment has to be continued with 3 to 4 months. That is very important clinically. Okay, so you should be knowing this. Okay, so coming on to the clinical integration. Okay, clinical integration, that is number 1 entity, onychia. What is onychia? Inflammation of the nail folds which results in the pus formation and shedding of the nail. Okay, then you have number 2 entity, that is known as onycholysis. Onycholysis, that is detachment of the nail plate from the nail bed. Okay, number 3 we have onychocryptosis. cryptosis. This is ingrown toenail, very common entity actually. In the dermatology postings, you will get to see these cases. It is a painful condition which is characterized by penetration of the ingrown toenail towards the lateral nail fold. Okay, it is very painful condition obviously. Then you have onychodystrophy. Onycho means nail. ठीक है, onycho common है ना word. Onychodystrophy, that is deformation of the nail. Okay. Then you have paronychia. Paronychia is bacterial or fungal infection of the nail base. Again, very common thing. Okay. Then you have number 6, that is koilonychia. It is also known as spoon shaped nails. Spoon shaped nails. Okay. So this is due to the iron deficiency or B12 deficiency. Okay. Then you have something known as nail clubbing. Okay. So let us come to this. Number 6 tha हमारा, 7. Number 7, that is nail clubbing. This is very important clinically. So bulbous swelling, see, just see the photo also how it is present. If you place your nails of the 2 index finger together, you can normally see a window between the 2. Can you check whether there is a window or not? If you approximate them together, there should be a window through which you can see. Okay, that window is gone. Okay, so it is obliterated in case of clubbing. Okay, so that is the Shamrock's window test. Okay, and then there is a Lovibond angle, which actually you can see it is increasing more than 180 in case of a clubbed finger. Okay, so it's something which is related to multiple diseases you will study in the medicine. Okay, so what is the cause behind this nasal clubbing, also nail clubbing? This is due to the reduction in the amount of circulating oxygen. Okay, so that is due to the hypoxic changes. Hypoxia causing proliferation of the nail bed and resulting in the clubbing. Okay, so any disorder with prolonged hypoxia, for example, any kind of lung diseases, chronic disease I am talking about, heart diseases, certain heart diseases, etc. So there are a lot of things you will study in detail में. Then you have the Shamrock's window test, which I just told you. ठीक है. You have Lovibond angle, which are clinically asked in your viva also, which you should be knowing, MCQ also. Okay. So then we come on to the entity that is the hair. Okay. Now let us talk about this hair. Okay. So they are elongated keratinized structures which cover the entire body except the palm, sole, the sides of the hand, feet, lips, ventral surface and sides of digits, the part of genitalia somewhere, and hair growth and texture. This is influenced by the hormones. Okay, so that is something important. So hair has certain parts. Okay, so what are these? Number 1, let us see. The hair has the following parts, like number 1, the hair shaft. Shaft is the visible part of the hair that projects above the surface of the skin. Then you have a root. Okay, root. Number 2, इसमें लिखा नहीं है. Okay, number 2 is the root. Actually histology image है ना, तो इसमें you won't be finding the other structures. Second part is root, which is embedded in the skin and enclosed by the hair follicle. Number 3, you have the bulb. Okay, which is the lower expanded end of the root of the hair. Okay, so hair follicle is the dermoepidermal sheath which covers the root of the hair. Okay, so you can see this is the thing about the hair, parts of hair. So hair shaft, hair root, bulb. The hair shaft and root, interestingly, it consists of keratinized cells, okay, and the hair is considered as a modified part of stratum corneum of epidermis. So hair shaft has three parts. What are these? You can see very clearly. Number one, that is the medulla, number A medulla, B cortex, C cuticle. ठीक है. So these are the parts of the hair shaft. ठीक है, important है, एग्जाम में पूछा जाता है. Then you have this hair follicle, which has the parts which are the you can say two layers classically for MCQ purposes only. There is a Huxley layer and a Henle's layer. ठीक है. Now Henle's layer is a single layer of cuboidal cells with nuclei. Cuboidal cells with nuclei. And Huxley layer is the double layer of flattened cells. ठीक है, that is the squamous cells. Okay, that is the Huxley layer and Henle's layer. Okay, so this is about the hair. Don't go into too much detail about the hair. What I am telling you, that is, I can say, more than sufficient. Okay, so you can see another image depicting the different parts of the hair. The hair shaft, which has medulla, cortex and cuticle. Here you can see the hair follicle, which has the internal root sheath and outer root sheath, Huxley layer and Henle's layer. ठीक है, so these are certain things which you can find for the hair. Okay, parts of hair. Huxley जो है, that is the one which is with the squamous layers and squamous cells, and Henle's is with the cuboidal cells. तो ये याद रखना है, that is important. ठीक है. So another thing clinically relevant before we go further to that image. ठीक है. Clinically, what is important? The cortex of the hair is the one which determines the color of the hair. Okay, so the cortex determines the color of hair. ठीक है, so color is produced by underlying melanocytes, which you know. Then there is something known as graying. Okay, इसको अलग तरीके से लिख देते हैं. क्लिनिकल में that is the color of the hair. ठीक है, color of hair. Then you have the graying of hair, and this is also very common. In old age, hair become gray or white. This is due to the lack of production of melanin, due to the progressive decrease of tyrosinase and increase in the number of air spaces in the cells of the medullary shaft, which accompany the aging. Okay, so this is something which you should know. And then you have something known as texture of the hair. Okay, texture of the hair, which is determined by this cross sectional shape. So it can be straight hair, wavy hair, kinky hair. Okay, so there are a lot of things to discuss, but we are not going to too much detail because वो trichology पूरा अपना topic ही है, अलग से डर्मा में पढ़ोगे. Just have a look at the various photographs for the most common derma problems which you will see. So there is something known as alopecia areata. Alopecia areata, that is spot baldness, that is the hair are lost in a small area of the body. Area of alopecia areata, it can be the periphery of this is the exclamation mark hairs are present. It is characteristic of the alopecia areata. Then you have something which is known as herpes zoster vesicles, which you can see here. Psoriasis, silvery flaky skin, pemphigus vulgaris, which we discussed in the beginning, autoimmune. Then acne vulgaris, the pimples. Then keloid scar marking, epidermolysis bullosa acquisita, melanocytic nevus. Okay, let me just highlight the most important and common ones. Okay, that will be giving you much more insight. Vitiligo, ठीक है, clubbing, sebaceous cyst. So these are some which you will get to hear more often. Okay, even this pemphigus also you will hear, but ठीक है. The ones which I have highlighted in yellow, they are the most common ones. ठीक है, most common conditions. ठीक है, the ones which I have highlighted in yellow. Okay, so then you have the sebaceous glands, which you can see here. Okay, so this is the image showing the sebaceous glands. ठीक है, which are the holocrine simple saccular glands, which are the ones which are secreting the sebum. Okay, they are the ones which synthesize and accumulate sebum. ठीक है, so that makes the clinical integration very important here. Number one, that is the seborrhea. Or I can say oily skin. Okay, overactive sebaceous gland which produces sebum, excessive sebum. Number two, acne. Acne vulgaris occurs due to the during the adolescence in both the sexes. So hair follicles, they get clogged with the dead cell debris and the sebum. Okay, so that I told you. So you can see this hair follicle, you can see this sebaceous glands. This is the hair shaft which is shown here. So sebum secreting cells which you can find here. This is the classical pattern which you will find, sebum secreting cells. Okay, then we have something known as the sweat glands. Okay, so sweat glands are the ones which produce the sweat or the perspiration. Okay, so there are two types of sweat glands which you can see here. The eccrine and apocrine. ठीक है, so the eccrine, they are the typical or the merocrine sweat glands. ठीक है, they are the typical or I can say merocrine sweat glands, and apocrine, they are the atypical then. ठीक है, atypical or I can say apocrine. Okay, so the difference is that eccrine is the one which is very important in the sense they are distributed all over the body except the lips and the external genitalia. Okay, so they are present throughout the body. Okay, and you can see this apocrine atypical sweat glands, they are the ones which are present only in the axilla. Okay, in the areola and the nipple complex of the mammillary gland. Then you have the skin around the anal opening. Okay, the external genitalia. Okay, all that part, axilla plus I can say the areola, nipple. ठीक है, and if we talk about this one, throughout the body except the lips and external genitalia. ठीक है, okay, so distribution is very important. Okay, so they are responsible thermoregulation and these are responsible for production of pheromones. Okay, so you can fairly remember this. This is something which you can revise in the end also before going to the exam. And then we have last few things left to discuss, that is the clinical correlation with respect to this glands, that is the glands related to the skin, which are including the apocrine, the eccrine sweat glands, the sebaceous glands. We will cover all these glands wala chapter in the histology, okay, in detail, so don't worry upon that. Okay, so this is the image showing the glands related to the skin, okay, in this which you can see. And the mammary gland or the breast, they are the modified sweat glands, which I told you, okay, modified sweat glands. And then there is something condition known as the gynecomastia, that is abnormal development of breast in the males, okay. Then you have classically the thing that is known as the skin burns, okay, which you should be knowing about, skin burns. Now there is two kind of skin burns classification. First is on the basis of the degree of the burn, okay. So that is first, second or third degree burns. Then according to the area of the skin involved, area of the skin involved, ठीक है. So सबसे पहली first classification, that is the first degree, as you can imagine, इसको लिख लेते साइड पे. First degree, that is only epidermis is destroyed, okay. It results in redness or swollen skin. It is painful, but it heals in 3 to 6 days without scarring. Second degree burn, that is involves the epidermis plus part of dermis, ठीक है. So it causes blister formation, okay, very important. This causes blister formation. पहले वाली डिग्री में नहीं है, ठीक है. इट्स नॉट कंपल्सरी कि ब्लिस्टर बनेंगे, फर्स्ट डिग्री में तो नहीं है. सो दिस सेकेंड डिग्री इट हील्स इन फ्यू वीक्स विद और विदाउट स्कारिंग. नंबर थर्ड डिग्री बर्न इज इन्वॉल्विंग एपिडर्मिस प्लस डर्मिस plus the underlying tissues. Now underlying tissues involves the muscles plus bones, okay. It can lead to bone charring also. So the burned area is insensitive to touch, it heals with scarring obviously, and this requires the skin grafting. This is the most severe variety out of the three, ठीक है. So these are the degree of burns. Then you have the area of the skin involved, that is taken care by the rule of 9. ठीक है. Rule of 9, it is an easy method to estimate the percentage of the body surface area burnt. So head and neck is given 9%, ठीक है. The each upper limb is given 9%. Each upper limb is given 9%. Then front of the trunk is given 18%, okay, front and back including. So it has total, you can see 18%, okay. And then you have each lower limb, that is again given 18%, ठीक है, front and back. So and then the remaining 1% is for the perineum. So that is a rule of 9, okay. So 9% याद रखना आसान हो जाता है, ठीक है. So 9 आगे है, 9 पीछे, so total 18 obviously. So that is it about the skin burns which you should be knowing. इसकी details eventually you will learn in the dermatology only. So that's it. I hope you have understood this topic well, okay. So that was the skin and its appendages. See you in the next class, and please keep on revising, don't miss the topics. Take care.